last year, spring of 2024, I went on a listening tour and basically met with as many employees as I could, asked them questions about their workplace, what they enjoyed about their public health work, what they enjoyed about their area, serving their community. And I was fortunate to talk to a little over 100 people initially throughout the state, which was really exciting. In that first listening tour, we learned a lot about what employees wanted to see as far as culture was concerned. You know, they talked about their workspace, you know, needing improvements to make their work more efficient and make it more pleasurable. They talked a little bit about recognition. They'd love to be recognized, but I do think New York State has some really great initiatives for recognition. But the one thing we did hear a lot about was they wanted more connection. They wanted more space to connect with each other, with their leaders, with their supervisors, with people in different regions, and just have more informal, social, collaborative environment. At the time, I was fortunate enough to get a public health fellow on board, and so her and I sat down and we created Energy. This publication is so unique because we wanted to share personal stories of public health employees, our workforce, that were very personal to them. This was not about the public health work, but it was about the person behind the work. I shared a story about being a mom and what that meant for me to show up to work every day. Sometimes it meant being frustrated with my son, you know, who didn't make his own lunch that day. And I shared an experience about being in the break room and having this conversation with a colleague who happened to just send her child off to college for the first time. And when she saw me frustrated, you know, she said, cherish this time because you're going to be sending your kid off to college and you'll miss that. And I shared that story inside our first publication. That employee actually came up to me. She knew I was talking about her, and she said, I never knew that impacted you that way. And I said, yeah, it really made me stop and think, you know, I'm not gonna have many of these mornings where I get to argue with my son about making lunch. And she's like, anytime you need advice about, you know, working through this, I'm here because I feel like I need somebody too, because I was a single mom and now my only child is away at college, and I definitely struggle with missing them. And so the response we got after we shared that story, Sarah and I, was just tremendous. Just knowing that first issue made such an impact on connection, we knew we had something really special here. And so over the next year, we published 4 issues. We're on our 4th issue now, and we've gone from 10 pages our first issue to our fall issue for this year is going to be about 60 pages, which is tremendous. The stories, now we have people emailing us saying, hey, I would love to share about this. We have one on chronic pain. We have somebody who shared that they struggle with bipolar, and it's a fun, quirky story about their cubicle space, which is always fun when you walk by cubicle spaces that are very colorful. And so to hear the reason why is just, it's so humbling, I think, as an employee. And it's just a reminder that we should stop to get to know each other and how much it's going to impact our public health work. That's what I'm really excited about this publication really doing. I think the message from our team was to remember that every public health employee is also a New Yorker. That the work that we do at the Department of Health, 5,000 plus strong, is not only in support of our communities, but we are community members. Our workforce division director is passionate about this concept of inside out, in that everything we are putting out for our public health work, which is so tremendous with the resources that we have to remember that the people behind the work also live in the communities that we serve. They are sending their children to school. They are shopping in the same grocery centers that, you know, we are inspecting and supporting. They're sending their kids to camps in the communities that we are serving. And so they are not only our biggest advocates, but they're the ones that we need to support the most from a workforce perspective. And so I was really hoping that energy would remind leadership and remind our communities that these are people first and they are public health employees second.